opinion and analysis from the briefing. Today is July 14th, and this is an update on the California prison system and the crisis there with COVID. Today, the death count in our California prisons has reached 34 due to COVID-19. COVID initially hit in the Correctional Institute for Men outside of Chino and also has struck San Quentin outside of San Francisco. Governor Newsom has stated that he has a plan to release 8,000 incarcerated people back into their communities. The question is the plan and how our communities can absorb these folks, as well as the continued crisis of COVID happening in the prisons. I'm going to talk about three things today. I'm going to give you some background on our California prison crisis. I'm going to talk about how we got here to this crisis with COVID, and I'm going to talk about the plan. So, background on our California prisons. California, as enlightened as a state as we are, we like to punish. We have 3 strikes, a law that has allowed folks to stay in prison for far too long, and we have a practice of long and harsh sentences. We also have this thing called probation, which is a pipeline back into the carceral system. We know that 8% of those that are in prison now are in because of technical violations to their probation. They missed an appointment, they did not show up for a test, they did not fill out particular paperwork. That, on top of 3 strikes and our harsh sentences, allows us to have a prison system with a capacity of 129%. We have 112,000 folks in our prison systems here in California. It's a system designed to hold 89,000 people. So even with this release plan to get 8,000 folks out of the prisons because of COVID, we still would not be where we need to be as it relates to our prison system. Okay, COVID. So March 25th, there was 1 positive test of COVID. As of today, we are at 6,300 across our prison system. We know that there was a transfer of an incarcerated person, from the Correctional Institute for Men in Chino to San Quentin. The transfer happened 3 weeks after a COVID test had been administered. So the lateness of the test, the staleness of the test, and then the transfer happened. The person went into San Quentin, then 25 positive test case happened in San Quentin, and an explosion erupted within the prison as it relates to COVID. We also know that CDCR, the California Department of Corrections and Rehabilitation, did not allow for free testing that was available for folks who are incarcerated in the prison. So they said no to free testing, and the employees within the prison system were not mandated to be tested for COVID. That creates a petri dish for COVID to happen. We also know that there was a transfer from San Quentin to the California Correctional Facility in Lassen County, where there has now also been a spike in coronavirus cases. As a result of all of that, the governor has said that 8,000 folks are scheduled to be released. But those people who would be released cannot have been convicted for a domestic violence offense. They cannot have been convicted for a violent or a sexual crime. We know that 67% of the folks that are in prison now were convicted and charged for those crimes. We also know that 1/4 of the population in our prison system is over 50, and we know that a majority of those folks came in with pre-existing conditions. So who are the 8,000 folks going to be? Will we be able to meet the threshold in terms of lessening the folks that are incarcerated, who already probably should have been released because of time served, because of good behavior, because they were close to their original release time? And then releasing them out to community-based organizations who understand this population, who want to help, but who are not being funded and supported by the state to handle this enormous number of transfers of formerly incarcerated and incarcerated people. Where do we go from now? We have to keep talking about this issue. We have to keep helping folks understand the background of our California prison system, who the folks are who are housed, and how we are killing them through COVID. And because we are not really talking about humane ways to release folks and to enter them back into society with supportive resources from community-based organizations and without declaring this a public health emergency in our California prisons. This is Sydney Kamlager signing off for the Dispatches, and I will see you on Friday with more information. I know this was a lot. There's more to come.